Arkadaşlar Oyun kanalına hoş geldiniz. Ben unutmayın sizlerle birlikte oyun incelemenin 4. bölümü sanırım arkadaşlar. Evet. Start'a hemen basıyoruz. Göz şeyini oynamıştık sanırım. Bakın şimdi. Lezik göz vardı. Akinator vardı. Ingrantunyalı arkadaşım çekmişti arkadaşlar. Çok eskiydi. 80 90 falan 100. Tamam. Surgery Squad.
Welcome to Surgery Squad's virtual limited open carpal tunnel release surgery. I'm Dr. Jeff, and I will be guiding you through the procedure today. Carpal tunnel syndrome. The limited open carpal tunnel release surgery is performed using a local anesthetic that numbs the carpal tunnel area of the hand and wrist. If a patient is nervous or uncomfortable, I'll sometimes use a sedative as well. A sedative is a drug given through an IV that places the patient in a dreamlike state. However, our patient today will only receive the local anesthetic. Go ahead and get the operating area numb. With the wrist anesthetized, we can now begin the operation. I've already tied a tourniquet around the patient's upper arm. Can you go ahead and outline where we'll be? Looks good to me. We'll be making a 3/4 inch incision at the intersection of those lines. Now take the scalpel and make the incision. Nice! I couldn't have done it better myself. Now we'll spread the incision wider to expose the transverse carpal ligament. This band of tissue is the cause of the problems. Place the retractors into the incision. I think you're a natural at this. With the transverse carpal ligament exposed, I'll need you to slip a carpal tunnel guide into the incision. This is a blunt-tipped instrument with a groove on the upper surface to accommodate a special knife. The carpal tunnel guide is placed down the carpal tunnel and underneath the ligament and is used to protect the underlying nerve and tendons. Go ahead and push the carpal tunnel guide into place. Once it's in position, you'll advance our special knife down the guide to split the carpal ligament. As you push the knife forward, you will feel it cutting through the carpal ligament. Perfect. With the transverse carpal ligament cut, the median nerve is no longer inflamed. Now we can begin to clean and close the incision. Go ahead and irrigate the wound. When you're finished, I'll release the tourniquet, allowing blood to flow back into the hand. Great. Now you'll close the wound using non-absorbable sutures. With the wound closed, we'll inject additional numbing medicine around the operating site to help relieve some of the immediate pain the patient may feel after surgery. And lastly, we'll place a small dressing over the wound to absorb any residual blood. We'll immobilize the wrist with a splint and a sling, and that's a limited open carpal tunnel release surgery. Thanks for stopping by. Why not try out some of the other amazing surgeries here on surgerysquad.com?
Bunu boş verin arkadaşlar, bir dahaki bölümde inşallah olacak. Bu şey yüzünden böyle biraz kısa olmuş. Şey yüzünden dediğim nedir onun ismi? Nasıl desem? Bu videonun kısa olmasının sebebi arkadaşlar. Zaten hafta içleri bilgisayara çok giremiyorum. En fazla girdim 20-30 dakika zaten kısa video çekiyorum, hemen videoyu yükleyebilirim diye. O yüzden arkadaşlar videoyu beğenirseniz sevinirim. Bu kadar emek vermeye çalışıyorum. Hafta içine girmeye çalışıyorum yasak olduğu halde. Yorum yapmayı unutmayın. Abone olsanız da sevinirim. Hoşçakalın.